They've hit some HITSM Twitter chat, Google Hangout. This is the first one. Woo! Yeah, Mandy Bishop. Yeah. It's more like Sports Center than it is.
I know. That's exactly. I think from a format standpoint, I think that doing this as kind of a Sports Center would be hilarious.
We need flashing graphics and loud music.
We could turn it on.
Hey, I could.
Look.
Oh, look.
Hey,
John. Okay, now you.
Just had to make you guys look bad, you know. And we have Chad Johnson, the
You gotta give Chad a banner. Give Chad a banner.
Founder.
Yeah, I need a banner. What's the deal?
Yeah, Chad needs a banner.
Here.
It's in the Hangout toolbox on the left. I think we should tweet this out so people can watch this too.
Here's my banner. Chad.
Go ahead. You do that.
Nice. Orion Health. Yeah, they just retweeted me. That must mean they like me. That's what a retweet means, right?
I have no idea. I retweet you a lot, and you're not always. You're not always critical. I don't think you're no longer.
You like me. You like me a lot. I think that's what those indications mean. Good times.
So what we have? Oh, I thought somebody else jumped on.
I think there's about to be a meta hitsum about innovation in water. That's cute.
Yeah, should we? Let me see if Kitterman circled me. Do you know her first name?
No.
I only know her as Kitterman Marketing.
She can come and introduce herself.
Yeah. Problem is I don't know how to invite her.
Well, she's gotta be on your circle thing, and then.
Yeah.
Yeah.
Enjoying the eye candy.
You're just now seeing that? That was like the first thing that I said.
Oh, yeah. Nice. Are innovators bored or made? That's a tough question.
I think it's a bit of both. I think you have to have a tinkerer. Is that topic 2?
I don't know. It was a question that HIT Lab asked. Innovators bored and made.
Well, I think that could be both, I guess.
Well, I guess the answer is always both. So is there a stronger tendency, though, towards innovation is more nature or nurture?
I was just thinking the same exact phrase as nature nurture.
Yeah. I think that some people are naturally more innovative, but I think you can develop it too. Maybe that's it.
Yeah, if you put in the skills and the hard work to become an expert in a field, then it's probably more easy for you to be innovative in some areas. And then some other people might just walk into a good idea.
Yeah, it's true. Some of the most innovative things were accidents, right? I mean, in fact, I wonder how many really innovative things were really directly thought of as, let's see, can we really be innovative on this? Or were they just accidents?
Right. But they probably both take a lot of work because you have to make them both reality other than just a good idea.
Yeah, it's true. A lot of them, right?
Right.
Kind of like the Alive Core. What's it? The Alive Core ECG on the iPhone. You couldn't have just accidentally happened upon that, right?
Right.
You had to. But then I guess that goes back to my first tweet that it's really innovative because and I love that I just said innovative instead of innovative. But it's a good innovation, but it would have never been possible if there weren't dozens of other innovations before it that made the iPhone that did all of the other things.
Yeah, I agree.
Recontextualize. That's a good. I'm always a sucker for big vocabularies. I find vocabulary sexy,
Yeah.
especially
I'm
when
gonna
it's
share this.
when it's a multilingual vocabulary, right, John?
Yep, that's true. I've seen that with you. I'm gonna share this stream. Why not, right?
Go ahead. Won't hurt anything.
Let's see, your Ocho text, right?
Yeah.
They're gonna all be jealous, so that's gonna be the thing. They'll be like, "Why wasn't I invited?" Next week.
Will be next week. Yeah, there have to be a format for this. Fridays are just about the only days when I don't typically have something in the middle of the day. It's been tough. I haven't been able to participate in any of the tweet chats recently. They're all like, Tuesday at 1 o'clock and I love Mel.
She's a wonderful lady and very original.
She is.
Like a virus that needs a full court press, assault to conform. Oh, I love Greg.
Yeah, I invited the HIT lab to moderate because they do a lot of public health stuff. We don't talk enough about public health.
That's one of the interesting things with HITSM. It can cover so many areas, right? And so some are more interesting to some people than others. So I think it's a challenging thing to balance them.
It is. But we talk a lot about how technology can help people who. We talk about the technology that helps people, or not so much the same audience that public health deals with. They deal with more like the common denominator, I guess, lowest common denominator in a way.
Yeah. No, it's true. We don't talk about public health very much. Nice. Cloud Health says John Doerr. Do you know who John Doerr is? He's a big-time investor in dozens of Silicon Valley startup companies. Made buku bucks. I can't remember all of his people, but lots of really famous names you'd know. Anyway, he said innovation without execution is a hallucination.
I like
think
that.
that's interesting. Reminds me of the patent trolls, right? That they patent something, they haven't built anything, and then they just sue other people that try to do the same thing.
Oh yeah, like unfortunately there are tons of healthcare companies that do that.
Yeah, and I've actually heard it's really becoming an issue in the device space, where there's some overlapping issues with patents. And
right.
It's going to get pretty intense. So.
Well, our laws can't keep up with the rate of change in technology. They also can't keep up with the rate of change in healthcare. So it's,
Yeah, patents would be an interesting future HITSM chat. I mean, there's so many facets to it, and it's so screwed up.
I wanted to go to school to be an intellectual patent attorney, and I was not math smart enough to get through engineering school. So then I became an English major.
And now you work on
and now I'm a computer geek, yeah.
Hey, if you can tackle health IT and integration, you can probably get back into patent law school, I believe.
I'm not sure why you'd want to, though. You might have to shoot yourself if you do.
It'd be interesting.
We got a viewer. I see. Yeah, our first viewer. Woo! Can you guys see at the top how many viewers there are, or no?
No.
Oh, just me.
Hi, viewer. Oh, it's so funny.
Definitely. So what was the second question? Do you see innovation in medicine different than in public health? If so, how? I think the problem is there's a disconnect between medicine and public health, right? And there probably shouldn't be. They should be more connected in how we work it and how we deal with it.
Yeah, it's a tough one because it's a you have to deal with more of the public in public health. I mean, when you talk and like a doctor deals with the patient, public health director of public health deals with a populace. Huge difference.
Yeah, well, and the other problem is doctors don't want to be seen as data entry clerks for public health, right? But they have a lot of the data and could benefit public health if they weren't afraid to share it.
Right.
I used to work at a medical society in San Antonio, and I worked on the public health committee there. And the director of public health, he was a real smart guy, and I'd go and talk to him quite a bit, and he would always say, "But if you can," we always talked about health literacy, and he would say, "If you can go down to the bus station and talk to people and have them understand what you're talking about, that's the level I work with."
Right.
And that's a completely different level than what we talk about usually on chats or in blog posts and whatnot. Completely different education base.
Well, yeah, and the education, health literacy in general is applicable across the board, right? It's not just about the patients needing to be educated. It's about the discrepancies between public health and the private sector.
Yeah.
Like Ellen Silvius was just saying how there's a difference between the VCs and what the rate of returns are and expectations for dealing in those public and private spaces. It's a very different conversation, and which is unfortunate because it does prevent innovation, I think, in the private sector particularly. So, because you can have innovation, but again, like innovation without execution is a hallucination. But the execution requires money, and it's difficult to get money.
Right. Kind of like the difference between a brainstorm and an innovation.
John, you're mean.
What? Oh. I like to bring it. It's funny, the hand washing thing is really interesting as far as innovation. The best talk I ever heard was the Freakonomics guy, Stephen Dubner, right? I think is his name. He
Yeah.
gave a talk at Digital Health Conference in New York about hand washing. And he's a data guy, right? And he's all driven by data and what it means and how do we interpret it. And I'll tell you this, there were 100% compliance in hand washing after his talk. It was kind of the running joke. We're in the bathroom, we're like watching, are you washing those hands? But it was interesting how words can have an impact and change behavior as well. So,
Yeah.
I mean, he also highlighted that they actually, the most effective thing they had to change hand washing was, I think it was a desktop background that showed the bacteria of not washing hands, or so something like that, some image that they would see and think, oh, I better wash my hands.
Right.
It's amazing what can influence you and change your behavior.
And that kind of illustrates the baseline. It doesn't baseline, but it illustrates how basic some things have to be reinforced. Some basic things like hand washing have to be completely reinforced over and over again.
Right.
That's just crazy sometimes to me to think that people in the healthcare need to be able to wash their hands.
I actually posted a thread in LinkedIn recently. It was like, what health IT innovations are doctors missing or something? It was off a blog post that Ann Zeiger had written. And someone said they're not paying enough attention to hand washing technologies or something. And of course, they were from a hand washing technology company. Which is the beauty of LinkedIn.
There's a hand washing technology company. Wow.
Yeah, have you not seen it? DebMed? There's actually a couple of them. they will monitor how many times it used. So if you walk into the room and you don't wash your hands, it keeps track of it and stuff. So I imagine you could do some RFID stuff on it as well.
Yeah.
You know,
There were a couple companies at HIMSS doing RFIDs. Yeah, they had RFID tech for hand washing, tracking.
That's
Interesting.
pretty cool. It's become like a bracelet, like a shock collar. So if you walk out without washing,
that's good. You didn't wash your hands, you get 20 volts.
second time it's going to be 40. Watch out.
It accelerates.
What if he gave, bedpan? What if he gave out the worst duties to the people who?
Right.
Wait, let's give them, give bedpan duty to the person who is the lowest.
I'm not sure someone not washing their hands, I want them cleaning the bedpans either, but.
So, what are the effective methods of globally diffusing innovative ideas and technology when it comes to getting healthcare user buy-in?
Wait, what? Is that one of the questions?
That's
Yeah,
the
that's the topic.
question.
Is that the third topic?
Yeah, it just went out.
Okay, I'm like, I don't see it yet, but that's a really long topic. That sounds like it must be way more than 140 characters.
Was.
That's creative.
I have to say that is the challenge. I've always been challenged with brevity. It is not one of my greater skills.
Yeah, we're up to 2 viewers. They like us.
To quote Sally Field, they like me. They really like me.
The interesting part of the third question is that we're kind of a biased group because I think our initial gut reaction is social media, right?
Right.
So.
Right.
Yeah, it's.
Well, we also have, honestly, and when I read the tweets, there's a lot of elitist. You can definitely see the people who are very product oriented and marketing oriented here, who have kind of an elitist definition of innovation, because you can innovate in the most common of spaces. I like Mel's, an uncommon solution to a common problem, but I think that there's so much focus on commercializing your product base for some of the people who are involved in this chat that they're downplaying the tremendous strides that can be made in a really super simple world. Globally diffusing innovation for user buy-in.
See, now Orion's trying to change the topic into something that's in their wheelhouse.
Of course.
How not to participate in a tweet chat.
He has his own typos. You'd think he was in a Google Plus Hangout.
All right. My biggest problem is trying to make sure that my retweets have the proper number of characters. I'm not going to solve world hunger today, and I'm not going to fix healthcare. I'm just going to make sure that my retweets all contain 140 characters exactly.
Yeah, I was listening to something recently that was talking about the challenge, and maybe it was Jonathan Bush's thing about why venture capitalists don't invest in healthcare. And part of what his discussion was that so many big companies control the spending in healthcare, and they don't want to let innovation in. I think it is a major issue.
Right.
I mean, the biggest company in healthcare, the biggest organization in healthcare is actually the government, right? Which,
right.
I don't think we need to say anything more about innovation in government, right?
Right. Well, and I see that on a small scale with the consulting I do to the payers, right? So in the HIE space and now in the Commonwealth space, there's these large entities that are forming, oligopolies. They have these giant conglomerates, and they're going to be defining the standards that we all have to make. So you can only innovate within the standards that these large oligopolies set. And yeah, it's the same with private insurance. Yeah, and on the payer space, it's unfortunate and sad. But
Do you
control of
think
market
that
share
standards is going to be their weapon of choice to try to
for
keep?
Commonwealth, I think for Commonwealth, absolutely.
Yeah. Hmm. I
I
never
just
thought of
missed that.
Mm-hmm.
standards as a weapon.
They can be, particularly when standards are not mandates. So the federal government isn't mandating the data standards, right, for clinical space. They mandated for the medical claims space, but not for clinical.
Yep.
So he who controls the standards on the large, for the clinical data, which is the next big thing in healthcare, Commonwealth is going to rule the EHR world.
Not if Epic has something to say about it.
Yeah, well, Epic. I love Judy's quote in Forbes that she thinks Epic is the most open healthcare company out there. Really, really, Judy, have you ever tried to integrate with a non-Epic system, Epic data with a non-Epic system? Doesn't happen.
Yeah, well, she said that they share a
Yeah,
million
we do it.
records, a million
Yeah,
records a month in the article. So, but
yeah.
I actually took that.
A million records a month, though, is so small. That is such an infinitesimally small number when it comes to the amount of patients that are contained within Epic systems. Like the
Right.
amount of
I
data,
did
like a
the
million
numbers,
records a
right?
month is nothing. That's
So
nothing.
they have about they said they have about half of the U.S. population's records somewhere in Epic, and so
Yeah,
that's about 150 million records if we round it. And so if they're doing a million, which is a little bit of a round as well, a million a month, that's 0.67% of
right,
their records that are being transferred every month.
right,
It's like, yeah, you're missing out on a huge opportunity, right?
right.
But I mean, that's a perfect example of what I'm describing, right? I mean, they're preventing so much innovation because they won't allow it to happen.
Right.
Or they want to charge for it too.
Yeah, it has to go through their customers. That's what they say.
There are ways, I mean, obviously we're a capitalist society, right? We've got to be able to monetize innovation. That is a given in our culture. But
It's fine.
yeah, it's unfortunate that so many large companies are going to, because the large companies control the market share, and have the opportunity, and the government capability to squelch innovation that might compete with them. Yeah, and we're setting ourselves up for failure. Like, we've created this system, and it is a self-sustaining organism. And unfortunately, I don't think that it is going to change as rapidly as some would believe.
Yeah.
It's frustrating because it could, and certainly if patients would get out, like if we really could galvanize the population of patients to get out there and make a difference, then the world could be different. But unfortunately, I don't know that patient education and the fire underneath, like, the vast majority of the American public's butts is hot enough for them to actually do something about it. It's going to take a revolt of the people. And now I'm picturing myself in Les Mis, singing the red and the black.
So an American cynic said innovation and profit don't always mean the same thing in the short term.
Well, and that's true, but in the U.S., in a capitalist culture, innovation without profit will die. So innovation without profit won't be realized.
Yeah, it's not going to get to market if it doesn't have some sort of backing or profit motive. People aren't going to create it just for the better good. That doesn't happen much.
Right.
No. The problem, I guess, also related to that is having enough people in healthcare that can have a long-term vision of creating something that's really innovative, that rather than looking for the short-term profits, they're looking for that long-term profits. I think that's kind of what they were saying, is too many in healthcare. I mean, I think EHR companies are a great example, every one of them. There's just so much money on the table right now to offer an EHR with meaningful use and certification that
Right.
no one's willing to really change the game because they can make plenty of profits doing what they're doing. So. Michael Gaspar has a good one. He said, I compare innovation to social media. Of course he would, since he's a social media guy, right? But his comment's good. He says, it needs to stop being a thing that you conquer and become the fabric of your biz.
Right.
It's good.
Yeah, I like that. I retweeted that one. Orion, interoperability and coordination between HCOs, vendors, patients, and providers can help diffuse innovation. Well, yeah, absolutely, of course. However, the problem is that interoperability and the coordination is now being defined by payments and profits still. So you can't have interoperability and coordination without a positive total cost of ownership model. You got your value-based pricing and all these other things. Until outcomes are measured by patients' quality of life rather than dollars and cost to the healthcare system, we're still
innovation depends on
never-ending cycle.
Innovation depends on people using the things, not on the systems or the records being passed along from system to system.
Right. And by the way, John, a friend of mine just texted me on a completely unrelated topic and told me that she too looks at engagement rings just for no apparent reason. So I am not alone in my girly habit.
So this Hangout is just like the
off topic.
chat.
Completely off topic.
It's about engagement rings.
I just said it was completely off topic, but John and I were talking about this right before the tweet chat, so he was making fun of me.
Yeah.
Tech and innovations developed in the U.S. that are translated elsewhere, like globally. Is this the question? Is this a
Yeah, this is the question. Can you name any examples of tech and innovations developed in the U.S. that have translated elsewhere and elsewhere that have translated here?
Oh, well, okay, of course. But are we talking specific to healthcare? Hello, automobile.
Yeah, it's healthcare, sorry. There's not
I'm pulling out a little sarcasm on that one.
Yeah, just a little,
I said innovation happens outside of the U.S. Boom! International folks.
They all just fleed the chat room.
I know my target market. It's U.S. Not really. I actually don't have that many international readers, which is interesting. There isn't much international collaboration. I've debated doing some Asia stuff. I almost flew over there a couple times, but yeah, it's been unfortunate because I don't think we do tap into the international innovations and discussions as much as we should.
And here we have the self-promoters.
No, there's no such thing on HITSM chat.
My favorite
They're usually pretty good.
Yeah.
They are actually. My favorite. I don't mind the self-promotion. The one that I love is when people freak out when people self-promote. Those are my favorite.
Right.
It's like it's kind of like in basketball. It's not the first foul you see; it's the second one. The retaliation. I don't see the promotion. I see the retaliation.
Right. It's kind of like the guy who argues with the ref is the one who gets tossed from the game.
Yep. Exactly.
Mobile health. Did mobile health develop in the U.S. though, or is mobile health something that's? I mean, it's certainly an innovation, but I don't know that it was actually developed here. We were slow to adopt mobile technology. Japan and others, the Asian market, it's actually beat the crap out of us when it came to, at least initial installation base for smartphones and others.
Well, it's a little easier too. I mean, they have huge bandwidth connections, but when all you have to do is 10 buildings versus, 1,000 homes that are across a much bigger area, yeah, different challenge, right? So some of that innovation. This is nice. Brian Eastwood, I always love his comments. He said, "Is slapping folks and saying, 'Stop, you can do better,' a bit much?"
Yeah, he's a riot.
And then Mel Smith Jones, in true Mel Smith Jones fashion, says, "Wait, you guys don't do that already?" Yeah. I think there's a video that could be made of that.
I gotta switch back to the video now. Okay.
You what?
I'm trying to switch back and forth from the video to the tweet chat window.
Oh yeah.
Here and there. I really do need to do the split screen. I need to call our IT guy over here and show me how to do that.
You need it regularly. It's more efficient, by the way.
So how many viewers do we have? I don't see it.
We lost one. Oh no.
We got bored. We got boring.
No, we still have one faithful.
It was the engagement ring talk.
Yeah, they heard about engagement rings and they started getting angry. They're like, sorry, I can't afford you, Mandy.
Nobody can.
Never again.
Oh,
All right.
patient identifier, huh?
That's it's not innovative.
So
It wouldn't be innovative for another country, but it is innovative for us. Because from a cultural standpoint, we simply refuse to require a unique identifier for medical purposes. We simply refuse to do it, and it would be extremely valuable. So in our culture, it would be innovative. It's not, it's not a traditional type of innovation, but to us, it would be.
That's a huge deal with semantic interoperability.
Yes, it is. Which, of course, is my, that's my thing. Dang it. So frustrating.
Which is partially what Commonwealth wants to solve. At least they've said that's our biggest problem that we need to deal with. So.
The identification of the patients. Okay, yeah. So what if you're able to create a unique patient identifier? So if they develop a master patient index within Commonwealth, which they of course will, and that would be smart. But look, they'll have the Commonwealth master patient index, and they'll also be doing the clinical data standards that would support interoperability at the UI layer across those different EMR systems. They're still not doing data interoperability. They're not doing structured data capture the way that the ONC is wanting to move forward with it. But at the UI layer for data services, they'll be able to pass information back and forth to their EHRs, and they'll develop a master patient index that's unique to the Commonwealth Alliance. But they can then, are they going to monetize that master patient index to? Yeah, of course. So, I mean, it's.
Are they? I don't know.
Yeah, I'm sure they will. Of course they will.
It's got to be stored somewhere, and somebody's got to have the storage for it and pay for the storage and maintenance and all that stuff. So.
Somebody go tell Dan. Go tell Dan that this is what we're doing. Athena, go tell Dan and John Bush that this is what we're doing. We know Dan Haley, John Bush. We know what you're up to.
Guys, we just got a second viewer. Just saying.
Oh, it's because I just said Dan Haley and John Bush. John Bush just popped out of the woodwork and decided that he, going to get fodder for next year's, hissies. Mandy throwing a hissy on the evils of Commonwealth.
I just scheduled my Google Plus Hangout with Jonathan Bush. That should be interesting.
Oh, you did a Hangout with him?
No, I'm going to. I just got it scheduled. Let's see. When did we finalize it? June 6th at 3 p.m. Eastern.
Can I come in and ask him all kinds of questions, because I really want to dig into what I consider to be the opportunities for Commonwealth, but I also want to ask these questions. I want to ask these questions about what they're.
A distraction. People won't be able to focus.
Yeah, I promise I won't be wearing a sequin dress this time.
No, it's actually going to be fun. I've done 3 Hangouts, and I have, I think, 3 more planned right now. One with Jonathan Bush, one with Mark Probst, and one with Encore Health Resources, Dana Sellers.
Cool.
Jim Kuba. So Jim's actually the guy you'd love because he's a big data guy.
He is a data guy, but I'm interested in the data guy, but I'm also very interested in the interoperability, and the whole Commonwealth Alliance thing to me is, I'm very concerned about it, and I would love to be able to dig in and learn more.
Yeah, I think that's the plan, is to talk with him about really kind of open systems versus closed systems, APIs, or some of that.
Yeah.
So yeah, feel free to send the questions. Although questions with Jonathan Bush don't work that well. It usually goes a bit like this. So let's talk about Commonwealth. I want to. I'll tell you about Commonwealth. You want to hear about Commonwealth? I'll just tell you. You're done, right? Your question's over. So whatever the first 3 words you say are, you get.
And you better have a bunch of backup questions. Put him a bunch of backup questions because he can answer all 5 of your questions in the first answer.
Right, right.
You don't need questions, right? All you have to do is say ACO, and then you're done, right? He just goes to work.
You should just make your question be, what's wrong with the healthcare industry?
Is there anything else you can think of that's wrong? That's your next thing, right? I love it. I've done 2 interviews with him, and he's the best person to interview by far.
Oh yeah, he's great.
Does the source of innovation matter? Yeah, it matters because some people will hold it and some people will share it, right?
I like the new hashtag that has come from Hitsum today. Unique and special snowflake. Yes, we are indeed.
What was the one we did last week? That whenever you use some analogy, what was the analogy hashtag? Hit some analogies or something. There was something.
I missed it. I wasn't able to attend.
We'll forgive you for now.
Yeah, I will be able to be more engaged now, I promise.
We all do what we can.
Is this your segue into ring talk again?
No. No.
You want to get her a ring? I thought you were
One has
married.
nothing to do with one has nothing to do with the other. No, I have just discovered I've gotten very, very deeply operationally engaged with a client, and that's not very conducive to this. Yeah, it's not conducive to growth and to continuing to further these types of conversations, which is important. Like this is what I really enjoy. So, although I really enjoy helping them too, I just, on a broader scale, it's important to stay strategic rather than be tactical, and I have a hard time balancing that, particularly with clients that I know very well.
Yeah.
Yeah.
Oh, we're up to 3 viewers! Woo!
Yay!
Although Kimberman just said, "May I call you post chat?" I can't quite figure this out. I can hear you occasionally, I can see you. Not sure who is in there. Sounds like she needs a faster internet connection. If you're listening, hey, Kinderman.
Oh, there's a chat. There we go. I really need to spend more time on here and figure this out.
Maybe for the last 5 minutes.
I like to think that I inspired John to actually start doing these Hangouts because he had never done one. He had never done one until we sporkled. Until we sporkled, you had not done a Hangout. It was all about me and this
our snorkeling. I thought that was private. I think I can't remember if you started it or if him said let's do one, and we said let's do one, and then I said all right, I need to test this before I do it, and so I tested.
Well, yeah. So I think that's what happened. You needed a test, but I was your test.
You are a test.
I was your first. I was your first, John. I was. I know I was.
Should I get Kitterman on the phone? Oh, crud, though. I didn't bring my cell phone.
Yeah. All right.
We had a big group on the chat today.
Oh, she's not even following me.
I don't recognize a lot of these. I don't recognize a lot of them.
So I tried to DM Kitterman, but she's not following me.
Tell her, here you go.
I'll say, sorry, I can't DM you.
Sorry. You don't follow me, baby.
Oh, that's why I should have done it. I should have done it on my Hangout account. Shared it. There we are. Our viewers. I think for the last 5 minutes, we should all share out the link and have a post thing. A post hit some.
A post hit some. Throw down. Yeah, we can wrap up. I mean, it is interesting.
Hit some Sporkle.
Yes, we should.
Do you know what Sporkle is, by the way, Chad?
We should indoctrinate Chad in the sporkling experience.
It sounds like.
Yeah, I don't know what that is. That sounds. I don't even know what. I don't even want to say what that sounds like.
You don't even want to say the Sporkle. Sounds dirty, but it's not. My child participated.
Sporkled with our children before.
No, I guess Twitter sounded pretty bad before too. So.
Yes. I information glut. Well, yeah, I mean, there is an information glut, but it's not an information glut. It's a data glut. We have a data glut that we're not actually using the data to create information. So we have this tremendous volume of data that's now available. We know how to capture it, we know how to store it, and storage is cheap, but we don't yet have the technology, at least widely adopted, to create information, or to create information that would be knowledgeable and useful to a patient. We can create information that, like, I could read, because I can go into HL7 transactions and I can read those. They're ugly and nasty, and I don't want anybody else to have to look at them, but I can read them. I wouldn't hand those to my grandma. My grandma couldn't read that. She wouldn't understand what the lab results are.
See, I'd be okay with that, though, because if we can just get it, even in an ugly format, out of the systems, then other people can make them pretty, right? I mean, people like yourself that understand it can put the interfaces in place that make them pretty. The problem is right now, you can't even get the data.
Well, that's going to kind of change a little bit. We're going to have, direct projects. It's going to help a lot with that. I mean, you're going to have to receive the CDA document, which is human readable. You can open it up in a web browser and read it. And it is much prettier than a big string of HL7 messaging. But.
Yeah. Well, I mean, but you look at the Blue Button Initiative, right? And people are downloading their medical records, but are they able to do anything useful with them? I would be very curious to find out, to do follow-up studies with people, with those patients who have downloaded their medical records. Like, what exactly are they doing with them? And are they able to make sense of them? Are they able to understand them if they are, not technical? Look at the larger population.
It's just a summary. It's just a snapshot of care. It's not the full.
Exactly.
But one of the cool things about Direct, and we're working on some materials about that now, is that let's say if you have health fault and your patient, your doctor, and they're on Direct, they can utilize Direct from the EHR, which if we use stage 2 EHRs, are going to have to use Direct.
Right.
They can send you, the patient, to your health vault direct email address, your medical record, which from there you can send to your other provider through their direct message, through health vault, your summary care document or whatever they package into that direct message. So it can be pretty cool. It's going to really help.
The direct protocol, it's amazing to me that it's taking so much time and energy to put together what's basically an email FTP service from EMR. But I'll be really excited, and I said this to Fritzman and to the poor guy who was running the direct. He was showing the direct integration at the interoperability showcase at HIMSS, and I was explaining to him that I don't want to see if I'm a doctor, I don't want to have to go and check for updates across multiple different EMR systems. I don't want to go and have to look and see, okay, well, he's a patient at this doctor. Do they have a record form? Okay, let me go look it up. And then they still have to print it out, and then they have to do a comparison, a visual comparison on paper of the records. I want integration. So to me, it's not useful until there's integration. But it'll happen. It'll happen.
Yeah, you're right. It's kind of funny because Direct helps kind of bypass that extra fee you have to give the EHR vendors to get the interfacing code. And then, so it allows the transmission, but it doesn't allow interoperability where you can, have a completely updated record at the same time. So in a way, it skirts the issue.
Right.
Yeah, you're right.
I mean, it seems to me Direct really replaces the fax machine. Makes it a touch smarter, but not much more, right?
Well, it makes it faster. Yeah, it makes it faster, and you have ready access, so you have immediate access to the same record. It's just as confusing. However, at least you have access, and so being able to develop the standards, like Eligible API, I'm really interested in. I like them quite a bit.
How much data is stored in the direct CDA document, though?
Well, there's two different things there. So direct is the transport method,
Right.
and the CDA document is the file that it's sending. So you can send whatever you want to through direct,
Right.
based on the IG profiles or different certain profiles. But CDA document is just basically a summary of care. So that's not your complete medical record, but you can send more through direct message.
Yeah, the CCDs and the EMRs are all implementing the CDA differently, right? So several of them are implementing CCD. They're in the infancy of CCD. The vast majority of them haven't completed their CCD implementations yet, and then they're in different. They're following different standards, and the style guides for CCD that would create the visualization, like the human readable components for your medical records, are all kind of predicated on your payer. Typically, it's the payer who sets the style guide. So you would have a different medical record for one of the insurance carriers.
Can I say hi?
Hi.
Hey, John's here. He wants to say hi.
Hi.
Hey, John.
Everything down.
Hey.
How y'all doing?
Yeah, you should just have.
Were you our viewer, John?
It's great that you're doing this.
Yeah, we figured that it was John's idea, John Lynn.
Yeah.
Chad had it. Although I'd thought about I think I'd mentioned it actually to Mandy before you emailed me. But yeah, I mean, we both had this idea, like it'd be fun to do, right?
Yeah. We've been talking about how we could possibly do a different format for,
Yep.
to do this as an ongoing thing and figure out how to structure it so that you don't have to try to pay attention to typing and tweeting while also talking. You have to do more like a sports center, we're the newscasters and do the wrap-ups and that kind of thing. The commentary on the tweet chat rather than participating in the tweet chat itself.
Right.
Yeah.
I like this. I said that I tweeted that the HITSM revolution is being televised and linked to this. And Gaspar said "cool" in all caps, which is pretty cool. And however you say DZ45TR.
Oh, Ryan. Yes, that's right.
He said overload. It's like, well, try being on it, right? He doesn't know overload yet. But that's actually what I love about the HITSM chat. Like, to me, it's I love the overload,
Yeah, you can really hang on to one string and get what you want out of it.
Yeah. That's good.
Yeah.
Very active today.
I've enjoyed just talking to you guys and kind of going off on my own little rants and tangents.
Well, that was the thing I
got
hated
into
about
CrossFit
hymns.
exercises, are you?
The
I
hymns
was
that
feeling
the
sick this morning. I did not
chat
go.
was boring to me because there was like a linear stream of discussion. And it's like, wait, no, usually the chat is like 7 streams at the same time. And that's much more interesting and engaging than one person talking than the next person.
Yeah.
Yeah. Yeah, it's difficult.
I've got another meeting. You guys
Bye,
have a
John.
good one?
That whole
Good
thing
to
called
meet you.
work.
See what it.
That's funny. Chalupa.
All right, so I have to go back to the chat. I haven't been over here for 15 minutes.
Oh, yeah, you should go back to the chat. All right, let's see what's going on here. The less exciting parts of Mel's day. She's so sweet. I love her. She's brilliant and she's sweet.
That great chalupa or just great?
I think
I
it's
think it's got an
great.
8. Great.
Yeah, it's okay. Telling her we want her on camera.
Oh, no.
Give me good ideas. Oh yeah, he's listening in. See? Woohoo! I think Kitterman and Ryan are the nice. Welcome to Hitsum Center. That's how we have to start it.
I need my own banner, John.
Just need to have a little boom box so you can have your intro music.
Yeah, that's true, huh? Could crank it up.
It'd have to be a boom box with a cassette tape. That'd be perfect.
I'll put it up here. Boom, boom, boom. I don't think I have music on this computer. Yeah, I could go to YouTube.
Cognitive bias and address diagnosis errors. Yeah, I would like to see that too. I like that we're able to, it's funny, that you've been on Twitter like a long time. When you see cog and you understand that that's cognitive, like there's all these really, you have to learn a whole new language. It's kind of like being a court reporter, only we're Twitter reporters.
That is interesting.
Yes.
It's true in healthcare, though. We have so many things. All right, you ready? Okay.
Are we ready for what? What are we doing now? He's letting people know that we're going to do a rap.
Oh, what's this?
Party rock? Really? Party rock? That's so 2012, baby.
I just put party music in YouTube, and that's what came up. So.
You need that that new Macklemore song, like Macklemore and Ryan Lewis, like the ceiling can't hold us.
He needs a smoke machine. That's what he needs.
He does. He does. And a disco ball.
I don't think my internet connection liked YouTube and this at the same time, though.
I am all for patients at the center, literate and healthy actions and equity. Okay, well that would be fantastic. I like that. Okay, I'm sorry. And now I'm looking back through the ooh, Cleveland Clinic. No, I won't be there. No, I wish.
I'm permanently confused.
You're permanently confused?
That's what Chad said.
Huh?
What?
I thought that this was fun. This was fun. We should definitely
Oh, Kinderman's trying to backtrack on why she wasn't following me. Saying,
Who is?
I'm on one of her influencer lists. That's how she reads my tweets. Which is an interesting discussion, actually. How do you follow different people?
Yeah.
I find out frequently that there are people who I see and interact with all the time, and I just don't realize that I'm not following them, and vice versa.
Right.
I'm happy that I finally got over that ridiculous 2,000 person barrier, because that was upsetting.
There's people like Vince who I've emailed with several times, but neither one of us followed each other. We just realized that last week.
Yeah. Well, like Dan Monroe from Forbes, he and I were co-hosting a tweet chat, and he actually had to he tweeted to me. He's like, hey, we don't follow each other. I can't DM you. I need to tell you something. What's going on? Funny.
My problem is I have multiple accounts, so maybe I'm following on one and not on another.
Yeah, this is yet another reason why I don't do that. I am just not talented enough to maintain, just that would drive me crazy.
Yeah. It does. That's why I'm crazy. That's all.
I have a feeling it has more to do with the 4 kids.
Yeah.
Yeah.
2's enough. I have 2. That's plenty.
Yeah, I've got 1 and done.
So John, get rid of 2 of yours. You'll be all right.
I can just give 2 to Mandy. It's called sharing.
Yeah, that's a great idea. Sure, absolutely. You want them to turn out like me? You really want
Dad, do you want some kids?
Oh,
Well,
sorry,
this
guys.
has been exciting. I mean, we've had up to 3 viewers. We maxed out at 3. This is going to be recorded and published to my YouTube channel. I
Oh,
don't know if
yay.
that's good or bad, but
Yeah, that's not a good idea, but okay.
what'd you say?
So that's not the best idea, but go ahead.
I mean, I can make it private if we want. It doesn't really matter.
I don't think it matters. It's not like we said anything bad.
No.
If anybody really wants to spend half an hour or an hour, kind of reading through or watching what we had to say, then them.
It probably does need a little more form if we want to
Yeah.
do it,
Yeah.
which could be interesting, right? I don't know if we want more than 3 or 4, though.
Actually participating in this?
Yeah, it would be
No,
too much.
I don't think so. I think that 3 or 4 would be a limit because any more than that would be overwhelming. I think particularly if we're trying to monitor the chat and talk about, you know what I mean? If we're depending on what you want to do, if you want to monitor the chat and then have a discussion about what's happening in the room, it helps that the topics are published ahead of time because you could already you don't have to wait until the chat gets going to actually have a conversation about what's going to happen that day.
Yeah, I'm trying to get better at publishing them on Wednesday. It always depends on various factors.
Depends on if they get them to you in time, right?
Yeah, or if I'm writing them, what I have going that week.
Yep.
But the Google community helps me get them out a lot faster, and everybody gets them and puts it in their calendar, so that helps.
Yeah. It's yeah, it's pretty interesting. I've actually one of these weeks I'm going to write a blog post about each of the topics before the chat. I just thought it would be fun to do something a little different, right? Like, what if I take those topics and I write a blog post, discussing each of the 4 questions? Just haven't had the right time.
Do you have any breaks in the calendar, Chad, where you don't have a moderator in the next month?
Yeah. In fact, most of June, all of June's open. I just got Kyle Murphy. He's going to do it in June.
Oh, Kyle is cool. He's a ride. I like Kyle.
Yeah, he's a smart guy. So yeah, if you want to do one, just pick a date. I think I offered him June 7th. Let me see if he replied real quick.
Okay.
And I can tell you right now, live.
We're up to
Kyle
3.
would be another good one. Actually, John, if you wanted to have Kyle in here, he would be another good one.
Kyle, which Kyle is it?
Kyle Murphy, but he's a competing news outlet, but still, he's very funny, very sharp-witted.
So he's doing June 7th.
He's doing June 7th. Okay, I'll go out and take a look and see when when's available. It'd be fun.
Do you guys see Ryan wants the whole YouTube, the whole chat published so you can watch the first 50 minutes?
Ryan does?
I guess that they want more.
That's funny. Go ahead. I don't care if you publish it. And no, I didn't see
publish
that.
automatically when I click end broadcast, it publishes it. So.
Oh, okay. Well, did you do that already, or are we still being broadcast?
Oh,
We're
no,
saying
we're
hi.
broadcast live and in person. Yeah, we got the whole country. We got Florida, Texas, and Vegas.
In Vegas,
so
baby.
all the important parts of the country. The South.
I'm heading out your way in July. I'll be out in Arizona, not in Vegas.
Yeah, I'll be in Hawaii in July. Sorry.
I've never been to Hawaii. That should be fun.
Yeah, we thought it would be fun to just work from Hawaii, so we're going to Hawaii. Fun times, huh?
Awesome. It's not nearly as far for you to get to Hawaii as it would be for me. I'd have to take at least 2 weeks, because that'd be a day and a half of travel time, basically.
Yep. We're going for, I think it ended up being 3 weeks. We were looking to do a month, but the timing with some other things we have didn't quite work. So.
Who's we? Is it you and your family, or is it you and, are you bringing Shad?
No, all of us are going, my whole family.
Okay. So when you're saying we, and
go.
we had these things planned, I was like, well, yeah, I thought you meant that you were bringing your business partners, and that you guys were doing a corporate retreat in Hawaii for a month. But can I get in on that? I would work from Hawaii for a month. No. I'd be happy to.
You haven't written enough.
I know. I need to get that right now.
All right. Well, this was fun. So should we end this broadcast and tell them to look forward to next week, where maybe we'll do it again, or maybe we won't. But it was a good test, and I think it's interesting. I mean, I think the chat in here is as interesting as the chat I was reading on the tweets. So
It was fun.
That's because we couldn't pay attention to the other side. But yeah, that was good.
Yeah.
it is a
was
good
fun.
point. All right. Well,